Okay, this talk is why fat is effed, dietary fat. Starting out, when you eat fat, it makes your blood more thick, more higher blood viscosity, more radio opaque. So here is blood in a centrifuge. The red blood cells go to the bottom. That's more than 99% of the cells in the blood. That's your hematocrit. The buffy coat, the little white spot in the middle here, is the white blood cells. Then you have the plasma, which is normally translucent. You can see through it. But when you eat a high-fat meal, it becomes opaque. Okay, we know that the more fat you eat, the more you get blood sludging together. Okay? That's called blood sludge or rouleau formation. The red blood cells are stuck together. It makes it harder to push them through a capillary because red blood cells are about 7 microns. You want to know that number, 7 microns. Capillary is about 5 microns, so they're bigger than the capillary. They have to deform themselves to pass through the capillary. Okay? And you have to pump at a higher pressure, so you get high blood pressure. Okay, now here is multiple sclerosis fat-oil relationship from Dr. Swank. He's a Harvard MD PhD, genius, neurologist, friend with Dr. McDougall, pioneered treatment of multiple sclerosis. This is his book. And he had the best results by far of anyone in the world. He had over 34 years follow-up. Here's one study where 34-year follow-up of the patients with early diagnosis of MS who followed his dietary recommendations. 95% of them were still physically active and living after 34 years. That's rather incredible for MS patients. MS patients usually have very poor outcomes. Okay. And he noticed that the most helpful thing was that they avoided saturated fat. That was the most important thing in his experience of studying MS patients for 50 years. And also just their fat intake in general was an indicator of their health. The higher amount of fat the patients ate, this comes from Swank's paper, the more multiple sclerosis they had and the more heart disease they had. So either way, they're screwed with increased dietary fat. And you look at this curve, where does it go? It looks like you want to minimize that fat curve. We don't have data from right in here, but the implication is you want to minimize your fat intake as well from that graph. Okay, he did a lot of work on studying the effect of fat on oxygen delivery, its effect on the blood-brain barrier. And he studied, he put electrodes into the brains of hamsters and see what would happen when he fed them high-fat meals, for example. Okay, and he found that the chylomicrons, one of the earliest manifestations of a high-fat meal in the blood, caused the red cells to stick together. This is the chylomicron curve. And they cause the blood to stick together for a prolonged amount of time, okay? And it took a while, you had to be 7-10 hours out before it was well reversed, okay? Look at this peak, a pretty high peak from about 2.5 to about 9.5 hours, okay? That's 7 hours of a lot of blood sludging, meaning thick blood, decreased oxygen delivery. That's not good. He felt that was damaging the blood-brain barrier. With the electrodes in the hamster brains, he noticed that he could drop oxygen delivery to the hamster brain tissue by as much as 35%. That's a lot. He noticed that the saturated fat had the biggest effect to drop oxygen delivery to the hamster brains. The intermediate fats with an intermediate amount of unsaturation. Saturation means that it's full of hydrogens. There's no double bonds. That's saturated fat. Unsaturation means you have a double bond. And olive oil is characterized primarily by having one double bond. That's called a MUFA, monounsaturated fatty acid. And that had an intermediate amount of dropping the oxygen delivery. The PUFAs, P for PUFA, polyunsaturated fatty acid, that had the least effect of dropping oxygen delivery to the tissues. So that sounds great, but there's a catch. The catch is the more unsaturation you have, the more double bonds you have, the more likely the fat is to undergo lipid peroxidation. And that can cause these terrible cascading chemical reactions that damage plasma membranes in a lot of tissues. So that's the screw job of fat. You're screwed either way. First of all the oils are totally obesogenic. They're the most caloric density food that exists, 9 calories per gram. We talked about sat fat having the worst effect to drop oxygen delivery to the tissue. intermediate fats like MUFAs were next. But the more unsaturation, the more lipid peroxidation. The O6 like arachidonic acid found, let's say, in meat and animal foods. You get more inflammation and tissue damage. It activates inflammatory pathways. You go with the O3s, you get immune suppression, which increases cancer risk. You're not as well able to get the cancer out of the body. You're not as well able to fight infections. You have increased atrial fibrillation risk, increased prostate cancer risk, and animal studies increase metastatic cancer risk. So you're not going to win with the fat. I'll show you a couple more pictures of what's going on. Here's lipid peroxidation. So here it would be an omega-6 fat. So you count from the methyl end. This is the carboxylic acid end of a fatty acid. It's an acid, and this is the carboxylic acid. Then you have a methyl group over here, CH3. And you count from here to where the double bond is. 1, 2, 3, 4, 5, 6. So this is an omega-6 fatty acid. Okay. Then here's the next double bond. So this is a PUFA, polyunsaturated fatty acid. And then the hydrogen right here, a carbon with two hydrogens is called a methylene group. This is called the methylene bridge carbon. It has only a weak grip on that hydrogen because the double bonds are pulling at the electrons. And it's very prone to an oxygen reacting with this methylene bridge carbon and forming what is called a peroxide, where you have two oxygens in a row bonded to the fatty acid. And these are very much at risk to cause chain reactions of lipid peroxidation and damage tissues extensively. So that's not good. Here's just one paper, kind of confirming what I said. Oxidation products are found in both omega-3 and omega-6 fatty acids during a simulated shelf life of edible oils. They found them in both the omega-3 and omega-6 oils, and it said oxidative markers observed the consumption were above the recommended commercial limits. You're not winning with either one of them. So anyways, that's just a little insight into dietary fats and why it's best to just get the small amount of fat that you need from eating low-fat plant foods. And it's quite a minimal amount. Like with Kempner, his patients are only getting about 2% of their calories from fat. There's been other studies. Nathan Pritikin has cited them two studies. One I think was by White, W-H-Y-T, another by McLean. I've talked about them in my other lectures, in my Kempner lectures. I'm sorry, my Pritikin lectures. Those are Pritikin lectures, those two papers. Patients were fed less than 1% of calories from fat, 0.7% of the calories from fat, and primarily omega-6s. And they did fine. There wasn't a problem with that. Okay, and you never see a patient with a fat deficiency problem. Okay. It's totally getting exaggerated to sell the stuff. Same thing in the olive oil. It's totally overhyped. And then there's all the fake paleo keto carnivores trying to pretend that fat is good for you. Yeah, right. It's good for you if you want to deprive your brain of oxygen.